Welcome to the Concierge Medical Marketing Podcast, the show dedicated to helping concierge medical practices grow and thrive. Hosted by Schwartz, a digital marketing expert with over 25 years of experience and a passion for improving American healthcare by helping concierge medical physicians succeed. Here's Schwartz.
Hello and welcome to the Concierge Medical Marketing Podcast. I'm your host, Steve Schwartz, and it's my pleasure to have Doctors Prisiliano and Monica Salas from Salveo Direct Care. Thank you for being my guests on the podcast today.
Thank you for having us. Yeah. Thank you, Stephen.
Awesome. Thank you so much. And tell us, where are you located? And tell us a little bit about your practice, what it looks like today.
So our practice is located in San Antonio, Texas. We have been around for a few years now. It was started by my husband, Dr. Prisiliano, about 6 years ago, or a little over 6 years ago. And then I joined him 4 years ago. And we consider ourselves to be a direct primary care practice. DPC plus, actually, I would say. We have a membership-based model. We really provide a high level of care and do provide some what would be considered to be more concierge type of services and access. But just outside of an insurance-based program, we contract with our patients directly on a membership basis. And so that's kind of what we do. We have some other programs and things that we have in terms of wellness, hormone optimization, weight management, care coordination, and things like that. So we do a lot of stuff. We wear many hats.
Nice. And so just to clarify, your practice does not accept any insurance. How big is your practice? How many patients either are you now, or what are your goals for growth?
Yeah, so traditionally, most DPC practices are very varied. I've seen numbers anywhere from 4 to maybe 600, sometimes a little bit more, but never is it a close to what a traditional insurance-based or fee-for-service clinic would be, which that's around 2,500 patients per doctor.
Yes,
so it's never going to be like that.
Yeah, I've told this story many times of my cardiologist who had over 3,000 patients on his panel, and he decided that he needed to start a new division or area of his practice that was concierge cardiology, and wanted 300 patients that would have his personal cell phone and the ability to call or text, paying the premium, obviously, for that level of access.
Right.
And then any of the patients that didn't switch from the 3,000 to the 300 concierge umbrella would be seen by his physician assistant. And it made great sense for him in his situation as a blended or a hybrid practice.
Yeah. And, that's something similar to how my journey was to direct care. Actually, my first practice, so our current practice, Salveo Direct Care, is actually my second practice. The first practice I opened from scratch was a traditional fee-for-service, 2 physicians straight out of residency. And we grew that thing to over 7,000 patients between the two of us. And so we were quite busy.
Yes.
So then I very quickly realized that I couldn't offer the care that I wanted to, the time, that I can spend with patients. I wanted them to have access to me more than, a week or two later for a cold that's happening today. And so I wasn't able to convert the practice like the cardiologist that you mentioned. My partner actually ended up staying with that side of the practice. And so I left, started direct care. And so our practice now is only a few hundred patients. When you're starting a DPC practice, when you're joining a DPC practice, the vast majority of the time you're joining from 0 patients, because the physicians in the practice probably are full in their panel. And unless they have a very long wait list, or in DPC, we also work with employer groups, for example. So unless there's an employer group that is teed up to maybe line up with when a new physician joins and they can start with a lot of patients there, the vast majority of the time you're starting from scratch. So the ramp up period, or rather there is a more aggressive, if you would, maybe ramp up period that needs to happen to try to get you patients there. You do have to put yourself out there a little bit with, community engagement. You have to get on social media one way or another, or, use a service that can help you with your marketing efforts. Because maybe the practice you joined have been doing well, they're full, but now we have to market the new physician basically from 0 patients. And so that can be sometimes a struggle, I feel like, for new physicians to understand, and maybe one of the fears, especially if you're starting out on your own.
Right. And I'm glad you brought that up, because many physicians are trained in medicine. They're trained in health, nutrition, exercise, these different areas related specifically to physical health. But correct me if I'm wrong, they typically don't teach business marketing in medical school, right?
Yeah.
They're teaching you medicine. And so I'm really glad that you brought up the topic of marketing to help bring in new patients to a practice. Obviously, my agency is Concierge Medical Marketing, where we specialize and focus on helping concierge and DPC practices with their advertising so that they can get the exposure they need, so they can share that message, as you said, on social media and website and blog posts and all that, so that people learn, get educated, and realize the value of having a membership relationship with their healthcare provider so that they can then sign up and have better outcomes. And as we talk about marketing, what different techniques or methods did you use to grow your practice to where it is today?
What haven't we tried?
And I'll take that since I've been in it from the very beginning.
Yeah.
Sure.
So, we've done all different things. We've done print ads in the local church newspaper, newsletter, or in the local community center on their TV screens. Obviously, we've done some SEO. We've done some paid ads on Google or Facebook. If you look on our social media right now at Salveo Direct Care, we obviously are trying to stay active there as well. We've hired someone similar to what you offer, Steve, but not maybe specific to direct primary care, but more just broad medical, someone local in the sense that does some medical marketing. We just hired an in-house business development and community relations associate. And so she's been now with us for about 7 months. And it's been great because we've had some new growth, and she's been helping with the onboarding some of those patients. We're trying to be more active or proactive with our member engagement as well. And then just be more active in the community too. So that we hired a new physician 3 months ago. She's been working closely with her again, just like I mentioned earlier, to try to get her out there and get people exposed to who she is and get her name out there.
Yeah. And even before she came on board, and our business development associate has been working with her to get her more out in the community. That's something that we've done a lot of over the past few years, which I think is really key, because it's not if you build it, they'll come sort of situation. I mean, even though direct primary care and concierge medicine are really great models and ways to practice, you do really have to be intentional about making sure people know that you're there. And I think one of the best ways that you can do that is allowing people to actually see your face and talk to you in the community. As hard as it is, and I know for doctors, sometimes that can be difficult because you think, oh my God, I got to see all these patients, finish all these charts, et cetera, et cetera. But then again, that's the nice thing about what we do, because we have that flexibility. We've really been able to carve out time over the years to be able to, go give talks to local community organizations, local interest groups, whether it be health talks or just talks about our services in general, attend health fairs, Chamber of Commerce events, volunteering with different organizations. I mean, all kinds of stuff. And the more that you really get out there and people see you and talk to you, the more they're going to remember you. And the vast majority of the time, people are not going to make a decision based off of one encounter, especially when it's a big investment for them. It's something that involves their health. Also, a membership. A lot of times people have to think about that. And so, a lot of times they need to talk to you a few times, and that's okay. But the more that you can really make that effort to be out there, the higher the rewards are going to be, and the more people are going to come in to see you.
Yeah. And you as a physician or your team, right?
Yeah, exactly.
They need to talk multiple times sometimes with anybody in your organization.
There's a term that we use in marketing called omnipresent. And the idea there is that you want to show your business's name, face, logo, message, literally as many times as possible on as many different platforms to the right people who you're trying to target. So, for example, this may not be your perfect target avatar, as we call it, but maybe looking for families, husband and wife with kids, 18 and above, who live within a 20-mile or so radius of your office, who maybe earn, I don't know, 80,000 or 100,000 per year total or greater. Along those lines, you can hone in on specifically the right category, is that the right word, of person, of potential patients you're looking for. And then the marketing that you do should resonate with those people, right? For example, some of our clients are really focused on business executives, business owners. Their time is so much more valuable than their money. They don't mind spending extra as long as you make it quick and easy for them, right? And so the marketing message would be, hey, are you a busy, successful executive who doesn't have the time to wait in lines and wait on the phone and all this for healthcare and would rather have healthcare come to you, right? Whatever that message might be.
Right.
And you craft that message specifically to resonate with those people, you're going to find that they're going to start raising their hand saying, you know what, that makes sense to me. I want that. You know, I'm a busy mom. I've got 3 kids and I'm running around the place all the time. I don't have time for X, Y, and Z. This membership thing sounds great. You mean I could text my doctor at 8:00 at night because little Bobby has a rash? Yeah, exactly. So I love this. I love this entire membership concept of medicine that truly provides better quality care, quicker, and less stress for everybody.
Right. Yeah, and I mean, at the end of the day, too, or really in the long run, we're trying to save the patient on the back end because insurance is so expensive these days. And one thing that a lot of people don't understand is that the more you use your insurance, the more claims you're generating, the higher you are a risk to that insurance company. Therefore, the premiums, like you pointed, are just going to keep going up. And so if you're not generating claims with a practice like us, for example, or a concierge practice, although some concierge practices still bill your insurance, but with a direct type of model, we're not generating any claims when you come visit us. So you can visit us as often as you need to and not have to worry about copays or generating claims against you and your insurance.
I think one of the best examples I've heard for people who don't quite get this concept is that when you buy a car and you want to drive it, you need auto insurance. And the auto insurance will cover you in case of an accident or it gets crashed or, damage somebody's property or whatever. But do you use your auto insurance to pay for gasoline, for windshield wiper fluid, brake fluid, the typical
oil
maintenance
changes?
Stuff? Oil changes. Yeah, the answer is no. Yeah, you don't use your auto insurance for these maintenance items. And similar with direct care, you don't need to use your major medical massive problem insurance for maintenance, right? And one story that I love to share, there's a physician with a concierge practice. I forgot where she was located, but her practice has a 100% success rate with her patients, 0 heart attacks. 0, not a single one. Why? Because they take the time and the effort and the tests and the talking and the back and forth so that anybody who even potentially had a problem, risk factor for a potential heart attack, was dealt with proactively. So there's a person who may have spent, $200 a month for their concierge doctor, avoided a hospital stay, the pain or risk of a heart attack, and all the therapy and stuff that comes after that, all avoided because of membership medicine.
Oh, yeah. And I love the analogy that you used because that's actually one of our favorite ones. We use it all the time, the car insurance analogy when educating folks about direct primary care. So we agree 100%.
Nice. One thing I want to chime on just a little bit more about the marketing. We are in a very interesting, exciting time right now where membership medicine is growing super fast. I've heard, going from like a $6 billion industry to a $13 billion industry in the next 5 years. I mean, literally doubling in size. And from tech geeks like me, this is the time of AI. AI, artificial intelligence, is literally a revelation, whatever.
Both.
In technology, literally, that we haven't had available to us ever. And the idea is that how could we take the power of an AI tool or system and use it to help us save time, save money, and have better outcomes. So just a quick segue with this is that I created a AI digital marketing assistant. And this assistant I call Maddie, M-A-D-D-Y. And the name came from MA for marketing assistant. And the idea there is that a medical practice, either DPC or concierge practice, can utilize Maddie, the AI digital marketing assistant, to help them with their digital marketing. And right now, the use of Maddie is free. I have it available for our listeners to try out and use. And I even wrote a book on how to use it called Just Ask Maddie. Okay. So the idea here is that you have an account of ChatGPT. You pay the $20 per month fee to them for the Plus account. That way it remembers the things you've typed in and gives you more, ability to communicate with it each day. And you onboard your practice into your account of Maddie. In doing so, it learns about who you are as a medical practitioner. What's the name of your practice? Where are you located? Who do you serve? What is the structure and size of your organization? And the extra, services, ancillary services, they focus on weight loss or hormone replacement or whatever it might be. And all of this onboarding effort, it asks you questions. And when it's done with this onboarding, it will then help you in your practice with pretty much whatever you need for your marketing, whether it's writing blog posts that are relevant and timely, writing email drip sequences, text messages, so much more. And so if anybody's interested in getting a copy of this book, it's on Amazon. Just Ask Maddie. It's like $15. And if somebody reaches out to me personally, I'll send you a signed copy. But I just wanted to mention that because you had mentioned you've tried all these different things with marketing. And sometimes people who are listening to this podcast are thinking, well, I studied medicine. I don't know anything about marketing. What should I do? Mm-hmm. And I encourage you, get this book, read through it. It's only 85 pages. It's super easy. But use it as a tool to help you with your brand and your marketing to get your foot in the door and get things started. Obviously, my agency is available to help if someone wants to hire us, of course. But if you can do it yourself or your spouse or a team member or the front desk person, do it yourself. Give it a shot. Maybe you'll have good success with it.
Right.
So those are just some thoughts. Have you guys used AI in any of the areas of your practice to this point?
Yeah. Yes. I mean, to your point, some of without the Maddie plugin or whatever it would be that into ChatGPT, but obviously we're trying to harness ChatGPT for precisely some of these things that you just mentioned. It's interesting because even our patients are now using AI. I've had at least a couple who have sent me a message, and it's a direct link to whatever.
Thank you for tuning in to the Concierge Medical Marketing Podcast. Please subscribe and leave a review wherever you listen to podcasts, and stay connected with us on social media. To speak with Stephen Schwartz about growing your concierge medical practice, give him a call at 772-304-2420 or visit our website at conciergemd.marketing. We will see you next time.